Hello all. Today we are going to discuss about local anesthetic agents. Local anesthesia means a temporary loss of sensation in a specific area of the body. The patient remains conscious during the procedure. It is mainly used for minor surgical procedures such as dental extraction or suturing. The most important point is it blocks pain without causing loss of awareness. So the patient does not feel pain but it is fully awake. Next, the pain occurs when there is tissue injury. When tissue is damaged, pain receptors are stimulated. A pain impulse is generated and it travels to the brain. Once it reaches the brain, we perceive pain. This causes discomfort, anxiety, and stress to the patients. So, during minor procedures, we use local anesthetic agents. These drugs prevent the transmission of pain impulses. As a result, the patient does not feel pain and the procedure becomes comfortable. Now let us see how the pain travels in the body. First, the tissue injury occurs when there is tissue damage. The pain receptors in that area are stimulated. The sodium channel opens the nerve membrane. When sodium enters the nerve cell, the depolarization occurs. Because of depolarization, an action potential is generated. This electrical impulses travels along the nerve fiber. Finally, the impulse reaches the brain, and in the brain, the pain is perceived. So this is how pain travels from tissue injury to the brain. So the local anesthetics are mainly classified based on their chemical structure. They are divided into two groups. The first group is ester type. Examples include procaine, tetracaine, and benzocaine. The second group is amide type. It include lidocaine, bupivacaine, and ropivacaine. So the important difference is that ester drugs are metabolized by plasma cholinesterase, while amide drugs are metabolized in the liver. Clinically, amide drugs are more commonly used today. Now let us understand the mechanism of actions of local anesthetic drugs. So step by step we can see. First, the local anesthetic is administered near the nerve. After administration, the drug diffuses through the nerve membrane. Inside the nerve cell, it binds to the voltage gated sodium channel. Once it binds to the sodium channel, it blocks the entry of sodium ions. Because sodium cannot enter the cell, depolarization does not occur. If there is no depolarization, an action potential cannot be generated. If there is no action potential, the nerve impulses conduction stops. And finally, if the impulses does not reach the brain, the pain is not perceived. So local anesthetics block sodium channels and prevent pain transmission. So let us see the factors that affect the actions of local anesthetic drugs. The presence of infection in infected tissues, the pH becomes acidic. In acidic pH, local anesthetic drugs work poorly. More blood flow means faster removal of the drug, and the adrenaline reduce blood flow and prolong the effect. So here, why adrenaline is added to local anesthetic drugs? So adrenaline is a vasoconstrictor. It constricts blood vessels at the site of injection. Because of vasoconstriction, the local anesthetic drug is absorbed slowly into the bloodstream. This produces three important advantages. It prolongs the duration of action. It reduces systemic toxicity. It reduces bleeding during surgical procedures. So adrenaline makes local anesthesia more effective and safer. Here, the adverse effects include CNS toxicity such as tremors and convulsions, cardiovascular effects such as hypertension and arrhythmias, allergic reactions, and methemoglobinemia with prilocaine. So, thank you all.